world was on fire, no one could save me but you. It's strange what desire make foolish people do. I never dreamed that I met somebody like you. I never dreamed that I loved somebody like you. No, I don't wanna fall in love. No, I don't wanna.
Hi, this is John Cullen. Welcome to Bedtime Stories. In this episode of Bedtime Stories, I'm going to be reading about Crimson Contagion, a joint exercise that was conducted from January to August 2019. And this was brought to my attention by one of our viewers. And I'm going to be reading a little bit about it from Wikipedia, and then I'm going to go over and read one or two articles about it. One, I guess, from CNN. I think I have another one here from like Daily Kos or something like that. So I'm going to read to you one or two of these articles, and then we're going to look at the full text of the findings from Operation Crimson Contagion. And these are preliminary, but it appears that they never finished it. So although it's 2 years old now. So we're going to take a look at Operation Crimson Contagion, and the reason is many people have been asking me to look at Event 201, which I have, and you can't really talk about Event 201 until you talk about Crimson Contagion. So welcome to Bedtime Stories. I'm John Cullen.
The world was on fire, no one could save me but you. It's strange what desire make foolish people do. I never dreamed that I loved somebody like.
Crimson Contagion was a joint exercise conducted from January to August 2019, in which numerous national, state, and local, private, and public organizations in the U.S. participated in order to test the capacity of the federal government and 12 states to respond to a severe pandemic of influenza originating in China. The simulation, which was conducted months prior to the start of the COVID-19 pandemic, involves a scenario in which tourists returning from China spread a respiratory virus in the United States, beginning in Chicago. In less than 2 months, the virus had infected 110 million Americans, killing more than 500,000. The report issued at the conclusion of the exercise outlines the government's limited capacity to respond to a pandemic, with federal agencies lacking the funds, coordination, and resources to facilitate an effective response to the virus. Between January and August 2019, President Trump's Department of Health and Human Services, headed by Alex Azar, runs a simulation codenamed Crimson Contagion. In this functional exercise participated the National Security Council, United States Department of Health and Human Services, United States Department of Agriculture, United States Department of Commerce, United States Department of Defense, United States Department of Energy, United States Department of Homeland Security, United States Department of Housing and Urban Development, United States Department of Interior, United States Department of Justice, United States Department of Labor, United States Department of State, United States Department of Transportation, United States Department of Treasury, between others, state and local organizations, public and private. During the simulation, several tourists fall ill with a respiratory virus that began in China and quickly spread around the world by air travelers with high fevers. The virus spreads quickly throughout the world, with the first detection in the United States occurring in Chicago, the host city for the exercise. The simulated virus was dubbed H7N9 influenza. Conduct of Crimson Contagion begins at a point 47 days after the first case is discovered in the United States. According to the results of the coordinating draft report, dated October 2019, the Crimson Contagion simulation registers 110 million infected Americans, 7.7 million hospitalizations, and 586,000 fatalities. Key findings. Federal government lacks sufficient funding to respond to a severe influenza pandemic. Exercise participants lacked clarity on the roles of different federal agencies and what information was important to pass on to federal partners. HHS had issues providing accurate and relevant information to hospitals and other public health organizations. Confusion between HHS, FEMA, and the Department of Homeland Security on which federal agency would take the lead in the crisis. The United States lacks the production capacity to meet the demands for protective equipment and medical devices, such as masks and ventilators, imposed by a pandemic. States were unable to efficiently request resources due to the lack of a standardized request process. State participants: Arizona, Colorado, Connecticut, Idaho, Illinois, Massachusetts, Nebraska, New Hampshire, New Mexico, New York, Pennsylvania, South Carolina. So this is the posting in Wikipedia about Crimson Contagion. And we're going to look at the PowerPoint presentation from Healthy Chicago, the Chicago Department of Health. And so this took place in Chicago. They were the host city for it. And we have their PowerPoint presentation. So let's walk through this and see what we think. Public health preparedness successes. Operation. Now, keep in mind, they just told us 586,000 people died. And these guys are touting their successes, which is fascinating. This presentation's by Christopher Shields, the Assistant Commissioner, and Frankie Shipman Amuo, the Director of Planning, Research, and Development, and was given September 18th, 2019. Operation Crimson Contagion, closed POD exercise, media campaign. The agenda: public health emergency preparedness and response overview. CDPH's role in Operation Crimson Contagion. Media campaign, public awareness. Public health emergency preparedness and response overview. Preparedness vision, a well-prepared and resilient Chicago. Preparedness mission. We help the city of Chicago prepare for, respond to, and recover from emergencies in order to protect the public's health and minimize adverse effects on residents, visitors, and the healthcare system. Values: accountability, efficiency, effectiveness, collaboration, credibility, integrity. Wow, this is the Bureau of Public Health Emergency Preparedness and Response org chart. And it looks like everybody rolls up to the Assistant Commissioner of Preparedness, Christopher Shields. So here we got Christopher Shields in this role. And we got a Deputy Commissioner of Public Health Protection, Maribel Chavez Torres. And the Chief Medical Officer is Allison Arwadi. And then over here we have the Commissioner. And the Commissioner is Dr. Julie Marita. And then the organization here. So this is the Bureau of Public Health Emergency Preparedness and Response Organization of the Assistant Commissioner of Preparedness, Christopher Shields. Oh, this is great. These are their partners. So here are the partnerships for Prepare Chicago, the Initiative of Healthy Chicago, the Chicago Healthcare Coalition, the American Red Cross, CCMEO, the Cook County Medical Examiner's Office, the Chicago Fire Department, Life Source, Chicago's Blood Center, the Renal Network. We got IDPH, we got the City of Chicago, we got GLHP, IPHCA, the Illinois Primary Health Care Association. We have the Office of the Medical Examiner, and then the CDC Chicago Quarantine Station, which if you haven't visited is really a great stop on any tour to Chicago. The Illinois Department of Public Health, the Chicago Police Department, and the Emergency Management and Communications Group from the City of Chicago. So a lot of great partnerships here. Wow, what a cool logo. Crimson Contagion. Ooh. Crimson Contagion 2019 series. The disease, H7N9, was sustained human-to-human transmission. Exercise series. Internal HHS Pandemic Influenza Tabletop Exercise, TTX. Completed January 23rd and 24th, 2019. Internal HHS staff. Chicago and Illinois Pandemic Influenza Tabletop Exercise. Completed April 10th, 2019. Chicago, Illinois Region 5 focused. Federal Interagency Seminar was completed May 14th and 15th of 2019. The NSC, Federal Interagency Partners, and participating states. And then Crimson Contagion 2019 Functional Exercise, we call that the FE, was completed August 13th through 16th, 2019. Local, state, federal, private sector, and non-governmental organization participation. Wow. Look at that. That's great stuff. Here's their inventory management system. And let's see what they've got here. The current program is RSS Whiskey. And they've got ventilator assets here. This says August 15th, 2019. Ventilator, Pulmonetic, Care Fusion, the LTV 1200 series, 1 unit. And so they're looking to receive that into inventory. And then here's their situation reports and all this other command briefing information and situational awareness, and fabulous. And they have trucks, right? That's great. And they have people with cones. That's also good. Some blue tent. Oh, it looks like they got dead people in the blue tent. These body bags. There's a morgue. So there's like a temporary morgue in a blue tent. And then down here, it looks like they got a big bat. I don't know what they use that for. And then here they got stuff on pallets. Goodness knows what that is. So let's celebrate their successes despite the fact that 586,000 people died. The majority of the outcomes were achieved. All right. There are areas of improvement, and they'll continue improving their collaboration, and they'll continue improving their PHEOC operations, and they have issues with communications and IT technical issues, and they'll continue improving their situational awareness. This is very comforting, right? This is a good plan here for these areas of improvement. And that's it. And September 11th, 2019, we're done. So, that's Crimson Contagion from their perspective. Let's see what CNN has to say. Now, this is reported at CNN Politics. So this is on the CNN website, but they're citing the New York Times. New York Times. HHS's pandemic simulation showed how U.S. was ill-prepared for coronavirus. By Veronica Stracholursi at CNN. This was published March 19th, 2020. The Trump administration ran a government exercise last year simulating a severe influenza pandemic for which there is no vaccine that showed the country was ill-prepared, according to the New York Times. The results laid out in a draft report showed that the U.S. was underprepared and disorganized for a pandemic scenario similar to coronavirus, which has spread to all 50 states and is yet to peak in the U.S., the Times reported. Last January to August, the Department of Health and Human Services ran a scenario named Crimson Contagion that included participation from 19 federal agencies, a dozen states, tribal nations, hospitals, and non-governmental organizations, according to the HHS draft report obtained by the Times. The fictional outbreak involved a group of tourists visiting China who then become infected and fly home to various countries, including the U.S., the draft report said. In this scenario, the virus is first detected in Chicago, according to the report. The HHS draft report concluded that the U.S. doesn't have the capacity to manufacture personal protective equipment, needles, and syringes. The report noted that these supplies, along with antiviral medications, respirators, and ventilators, would be limited and difficult to restock due to them being largely manufactured overseas. During the exercise, states experienced multiple challenges requesting resources from the federal government due to a lack of standardized, well-understood, and properly executed resource request processes, the report said. States were also unsure which government agency to request resources and information from, the report stated. In hiccups with planning, officials struggled identifying employees as essential and non-essential, as well as which employees could work remotely, according to the report. In the scenario, after the Centers for Disease Control and Prevention issued guidance to delay school openings, school districts went different ways, causing confusion among the participants, the report said. Since the first detection of COVID-19 in the U.S. in January, the virus has spread to all 50 states. While President Donald Trump has recently made more stringent recommendations about staying home and limiting gatherings to no more than 10 people, his administration has come under scrutiny for its slow response to the outbreak. Top healthcare officials warned that the U.S. doesn't have enough stockpiled medical equipment to fulfill the healthcare system's anticipated needs as the coronavirus pandemic continues and the number of cases tick up. Trump announced Wednesday that he would be invoking the Defense Production Act to address the medical supply shortages, but later said he'd only use the powers in a worst-case scenario. Trump previously declared a national emergency and invoked a special statutory authority allowing the Federal Emergency Management Agency to mobilize and tap into supplies and funding. As of Thursday, more than 11,000 people in the U.S. have been infected with COVID-19, and more than 164 have died from the virus. Well, this is the exercise key findings. So these are the key findings from Crimson Contagion. And this is still in draft format, so what are you going to say? But you see this from the U.S. Department of Health and Human Services Office of the Assistant Secretary for Preparedness and Response. I believe that used to be Dr. Nicole Lowry, actually, who we saw testify with Jim Jordan. Crimson Contagion, 2019, Functional Exercise Key Findings. Below is a list of the high-level, cross-cutting issues discussed in the key findings section of this report. Statutory authorities and funding. Existing statutory authorities tasking HHS to lead the federal government's response to an influenza pandemic are insufficient and often in conflict with one another. Currently, there are insufficient funding sources designated for the federal government to use in response to a severe influenza pandemic. It was unclear if and how states could repurpose HHS and the Centers for Disease Control and Prevention's grants, as well as other federal dollars, to support the response to an influenza pandemic. Planning. The Biological Incident Annex to the Response and Recovery Federal Interagency Operational Plans from January 2017 and the Pandemic Crisis Action Plan version 2.0 from January 2018 do not outline the organizational structure of the federal government when HHS is designated as the lead federal agency. The extent of crisis standards of care, planning, and implementation varies across local, state, territorial, tribal, and federal stakeholders. State and federal entities identified challenges in implementing remote work, telework policies as a workforce protection measure to maintain operational capacity. Operational coordination. The HHS Disaster Leadership Group and the National Security Council Domestic Resilience Group have the infrastructure and capabilities to successfully conduct virtual meetings during incidents necessitating social distancing. Exercise participants lacked clarity on federal interagency partners' roles and responsibilities during an influenza pandemic response. So this is a tabletop simulation exercise, and this was done between January and I think they wrapped it up in September, it says, right? So August through the summer, June, July, August. We saw those dates earlier. And then this is the draft of their findings. So this is the final stuff here. And this is 54 pages of findings. And let's wrap up with one more article. I think there was one from Daily Kos. Operation Crimson Contagion shows how the White House flubbed a test run at handling coronavirus by Mark Sumner, Daily Kos staff. This was published March 20th, 2020. When Trump officials were first moving into the White House after his inauguration, they went through a simulated pandemic that eerily matched the real conditions of COVID-19, including a need for increasing hospital beds, overcoming a shortage of ventilators, and providing a consistent national message. Obviously, any lessons learned in that exercise didn't stick. And now it appears that wasn't the only occasion, because last October, just 2 months before the first cases of 2019 novel coronavirus appeared, the Department of Health and Human Services conducted a series of exercises about a hypothetical virus that emerged from China, caused a fever and respiratory illness, was spread around the world by air travel, and generated a global pandemic. And the draft report from that simulation shows exactly what Americans are finding out the hard way. The Trump White House was dangerously unprepared. As the New York Times reports, Operation Crimson Contagion was actually a series of exercises intended to test every aspect of the government's response to the outbreak of a novel disease. The not-to-be-disclosed report showed the results of that test were nothing short of terrible. Without clear guidance, federal agencies sparred over their roles in fighting the disease. Without advanced planning, hospitals and other facilities were short on materials and overrun with cases. Without any coordination from federal offices, states and localities were left on their own when it came to determining things like school closings and other restrictions. The whole thing was a fair description of chaos, which shows that the exercise was highly effective in predicting how Trump's White House would react to real-world events, but an absolute failure when it comes to making agencies better prepared. And if it seems like something that happened in October might have been too late to generate the kind of lessons needed for a pandemic that began unfolding just weeks later, Crimson Contagion wasn't the only such effort. In fact, there have been 3 such simulations since Trump moved into the White House. Despite going through one of these tests every year, the latest such effort showed insufficient funds for responding to a pandemic, no clear way for states to take advantage of CDC or HHS resources, no agencies designated to lead various aspects of the crisis, no clarity on which officials were responsible for responding, no consistent rules across cities, states, local, tribal, and federal agencies, no planning for how state and federal agencies switch to working from home. Overall, the report showed that agencies involved in the exercise provided inconsistent and inaccurate response guidance and actions to healthcare and public health private sector partners. And neither state nor federal officials involved were clear on what actions they should take or what information they should relay. It seemed very much like the kind of result that might have been expected from those officials coming in the door and hitting the scenario for the first time in 2017, but not what should have happened 3 years in. The report also indicated there was confusion around the purpose of daily national reports, which is one problem the real world hasn't shared, because those reports are all about praising Trump. Maybe the most important results are those in which the real-world results were even worse than the test. The White House was slower to roll out testing, slower to insist on social distancing, slower to call for school closings. What the report said was the federal government needed to do more and faster. What the Trump White House did when confronted with the real event was less and slower. But the chaos, they captured that part of the simulation perfectly. This has been Bedtime Stories, Crimson Contagion. I'm John Cullen. Thanks for joining.
The world was on fire, no one could save me but you. It's strange what desire make foolish people do. I never dreamed that I met somebody like you. I never dreamed that I lose somebody like you. No, I don't wanna fall in love. No, I don't wanna fall in love without you. What a wicked game you play to make me feel this way. What a wicked thing to do, to let me dream of you. What a wicked thing to say, you never felt this way. What a wicked thing to do, to make me dream of you. And I don't wanna fall in love. No, I don't wanna fall in love without you. Without you. The world was on fire, no one could save me but you. It's strange what desire make foolish people do. I never dreamed that I loved somebody like you. I never dreamed that I loved somebody like you. No, I don't wanna fall in love. No, I don't wanna fall in love without you. Without you. Without you. Without you.